An already concerning shortage of nurses in the state has become even more dire during the pandemic as nurses flee the profession due to burnout and exhaustion. Pat Bean reports on efforts to rebuild the workforce, including proposed legislation.
Oni Thomas isn't deterred by the current state of the nursing profession. She was accepted into the Ivy Tech nursing program just as the pandemic was beginning 2 years ago.
I knew that a lot of people going into the profession, they were kind of hesitant because they didn't know what was going on, but really it made me want to do it more because I just wanted to help people.
National studies show that 1 in 5 healthcare workers have left the profession since the pandemic began. They often cite the added stress of record hospitalizations and deaths due to COVID-19. And a survey by the American Association of Critical Care Nurses reported 2/3 of intensive care nurses have considered leaving their jobs. By the end of this year, the Bureau of Labor Statistics estimates nearly 500,000 nurses are expected to retire.
I think fatigue, burnout, compassion fatigue. I tell my students, you're going to see people who are having the worst day of their lives. And when you do that every day, it does take a toll.
Reinhardt has been at Ivy Tech since 1984 and says the demand for more nurses has been constant.
But I think it has gotten a lot worse because of the pandemic. The need is greater. Society as a whole is aging, which means that we need, as those baby boomers need more health care and more extended care, we do need more people to take care of them.
Representative Ethan Manning is leading the push at the state level. He says 4,000 nursing jobs are now open in the state.
We're going to need 5,000 more nurses on top of that in the next 10 years to meet the demand of retiring nurses plus the existing need. So to do that, we have to have 1,350 additional graduates from our nursing schools each year for the next 10 years.
Manning, a Republican representing District 23, authored House Bill 1003. It loosens degree requirements, allows more simulation training, and lowers the number of required full-time faculty at a nursing school. The bill passed through the House with near unanimous support and is now in the Senate. Manning says he expects some amendments to address the concerns of four-year universities and the Indiana Nursing Association, but nothing to keep the bill from becoming law.
It's been a problem for a long time, but it's gotten even worse due to the COVID-19 pandemic. So I do anticipate in future years we'll have more legislation like this, but this is a great first step.
Those in the healthcare industry are happy the state is getting involved.
We hope that House Bill 1003 can be the first step in really a moonshot approach to how we address our healthcare workforce shortages. As far as big ticket items or the dollar amounts, I'm looking forward to next year when the budget is done. And I'm hopeful that we'll see a real investment there.
The good news is more people are applying to state nursing schools than can be accommodated. Reinhardt says Ivy Tech turned away 300 student applicants statewide last year. Ivy Tech enrolls about 160 nursing students on its Bloomington campus.
There's a tremendous opportunity now for people to get into the field, but it's a profession that requires a lot of training. So we're doing what we can with some legislation here in Indiana and the State House to try to help expand the pipeline, but the cavalry's not right around the corner. It's going to take a little bit.
But because of the shortage, nursing jobs are there for the taking.
We have so many employers who are asking, can we speak to your graduates? Can we come to your classes? More than we can actually accommodate, but our graduates always have jobs.
Reinhardt says Ivy Tech has received positive feedback for expanding its programs to help fill nursing needs in more places than just hospitals.
The military medic, the paramedic, and the medical assistant, they're very excited that we're offering those tracks, especially the military medic to ASN program. That may keep somebody in the healthcare field who normally might not have stayed in healthcare.
Now a senior, Thomas says she's eager to be part of a much-needed new wave of nurses.
So I know a lot of people are really hesitant, oh, I don't want to do this, but I'm just let's go, let's rebuild this, let's get it great again, because nursing is such a great profession and it's always going to be needed.
Now, more than ever. For Indiana News Desk, I'm Pat Bean.
We're joined now for more on this story by Brian Arwood, the president-elect of the Indiana State Nursing Association. Welcome to the show, Brian.
Thank you, sir.
So as we just heard, shortage of nurses is nothing new, but it's really been exacerbated by the pandemic. So what are you hearing from nurses?
Well, we as nurses, we're tired. We've been on the front line of this pandemic from the very beginning. We want help. We want people to trust in science and take precautions and be safe. Our nursing workforce is facing burnout. increasing retirements, prolonged high patient volumes, and it's creating this staffing crisis. We're dedicated to working toward statewide steps to provide greater support for not only for our nursing workforce pipeline, but also for our nursing workforce currently in practice. In response to the nurse staffing crisis, we encourage innovative change while remaining vigilant of long-term repercussions for the profession and the care in which we Hoosiers receive.
The author of House Bill 1003 said four-year colleges and the Nursing Association have some concerns about the bill that still needs to be addressed. What are those?
Well, at ISNA, we understand that the intent of the bill is to help to provide more nurses to the state of Indiana, which is sorely needed. Many nurses in academia are concerned that loosening restrictions on nurse programs, nurse education programs, can have a negative impact on the quality of education that nursing students receive. So we're hopeful that there's more of a balancing with enrollment expansion against quality safeguards. ISNA is obviously very appreciative of the attention that the bill has brought to the current staffing shortage to both the Indiana legislature and the public. And we hope that everybody does understand House Bill 1003 doesn't fully solve the staffing crisis that we're in, the staffing shortage, and that we're going to need to have continued conversations, and they're crucial for our nursing landscape. Future policy discussions are needed to further improve our nursing workforce pipeline and to provide greater support to our nursing workforce.
You know, Brian, we hear a lot about how nurses who will contract for travel jobs, working a number of months at one hospital and then moving to another. Is that something you encourage, or is that good for the profession?
Well, it's neither good nor bad in and of itself. Travel nurses are taking opportunity to travel, to get novel experiences across the United States and across the world in some instances, and they're getting really interesting perspectives. Travel nursing positions and the prevalence at which we're seeing them currently, that's just indicative of the shortage overall. And they fill a need. They share their expertise. They have to be experienced nurses in order to provide this care. That they're just so prevalent right now is just a symptom of the shortage overall.
Okay, Brian, we have to leave it there. Thank you so much for your time. Appreciate it.
Thank you, sir.